Okay, yeah. So I was discussing about the student I was talking about that she actually, she did not even like pass it. Like she conquered the exam. She got 460, 420, 90. Okay, so this is the score which all of you can achieve. Okay, and definitely she was taking the session, and after that, Alhamdulillah, by the grace of Allah, she had these results. Okay. Uh, Okay, so it's I guess it's a little bit okay to brag sometime about you, okay, if you achieve something. Okay, so let's just start the discussion over this letter. Okay, so if you see in this particular letter, let me just give you a background about this letter. So in this letter, this is first of all, if you see the case notes, this letter is a simple referral letter. All right. The patient is here for the uncontrolled diabetes. She's a known case of diabetes, okay? But the problem is she's not here for the first time because she's there like she's having diabetes, no, or she's having symptoms, no. She's there because she is actually compliant with the medication, but still she's unable to maintain her blood sugar level. She went to the clinic, okay, but she thought, according to her, the clinic where she actually went, they did not take her concern seriously. I'm just repeating the case notes to just give you guys a background. What important things are there that we have to mention. Okay, there are some visits. Okay, and you are a GP. You are sending the patient, or referring the patient to a consultant who is an endocrinologist. Okay, you want, what are your demands? You want further assessment and management because you're unable to manage at the moment. It's not that you don't know, but it is something which is not in your authority. Okay, and the other thing is that because you are a general practitioner, so you have tried what you could have. Okay, and now if you are unable to, then you have to be a safe doctor, and for that you are going to refer the patient to someone specialist. Okay, and that is definitely an endocrinologist, right? Okay, so what you want further assessment and management. So reason of the referral, quick recap, we discussed this yesterday. We had a discussion on the basic of writing, okay, and I hope I was clear about that. If not, then that's fine. I can talk about that many times. I have no problem with it. I can, go on with that. Even if you will ask me 1,000 times, I'll be definitely answering your questions and queries. And that is the reason I'm here, okay? So, so a background I was talking about, okay, so about the purpose, the reason, and the demands that we discussed yesterday, how to write it, you already know it. Then comes the visits. So there are some visits. One of the visits is today's visit, except that every visit is a previous visit. Okay, and there are quite few visits, like if I'm not wrong, 5, 6 visits that are included over there in the case notes, and they are more of the previous visits. Today's visit, in that visit, they have just given you information about random blood sugars, and the fasting sugar level is this and that. Okay, and the random sugar level is in between. Okay, between 7 to 8, or maybe between this and that. Okay, so this is the background. Then there are definitely other visits as well. We'll be looking at those visits as well. The first visit was about that I was discussing, that she thought in on that particular day she came to you. She was telling you that I went to that clinic. I thought I think that they are not taking my concerns seriously, even though my blood sugar levels are high. You check the blood pressure; it was 155/100. Okay, so these are the case notes that I'm telling you. This is the information you should have mentioned. Okay, there are a lot of information in that particular paragraph, but this is the information that I'm telling you. This should have been written over here. Okay, so just quickly, I'm just giving you a quick recap that what information you should have included. Okay, because when I'll be evaluating, I'll be definitely pointing out these words. Okay, and definitely if you have these things in your mind, then you'll be having a clear idea. Okay, so she presented her BP. Rest of the examination was unremarkable. There were no other findings. Okay, but BP was 155/100. If I'm not wrong. Then you assess the patient. Some relevant investigations you ordered, including full blood count, LFTs, HbA1c. Okay, but this thing you don't need to mention in a paragraph where you're ordering the investigation, because in the next visit you are going to receive the results and you are going to discuss those results with the patient. Okay. Then you have prescribed the patient candesartan for the blood pressure. Okay, and then again she presented on the next visit. She presented with the laboratory results. Full blood count and others were normal. Her GFR was more than 60. HbA1c was high. Cholesterol was high. This is like triglycerides were high. Okay, so these three were the notable thing. The rest of the examination or the findings were quite normal. There was nothing which could have been serious. Then you change the metformin regime because HbA1c was very okay. So the next you change the regime of the metformin. Before it was 500, now you started on 750. Okay, so regime change. Along with that, atorvastatin was added because patient had in the patient just received the results, and on those reports her cholesterol is high. Okay, so that is the reason we have added atorvastatin. Okay, and then the next visit, it was about 1 or 2 lines. If I'm not wrong, that was not necessary. You could have just skipped everything. Then comes the very important visit, that is today's visit, in which you just have been given 1 or 2 lines. You just have to copy paste those lines over there. There is nothing much of information over there. You just have to select that on this date. Like today, she presented with these things. And her laboratory reports were reviewed or had reviewed or has reviewed, whatever you want to write. We have already discussed about the sentences, okay, and the tense things. Okay, so I hope you're relating, just giving you the background, okay, whatever we have discussed till now in the whole session, okay, and I've given you everything about the basic letter writing structure as well. Okay, so then the random sugars were between 7 to 8 other sugars, okay, and the fasting sugar levels are high. I mean, if I'm not wrong, that was 16 plus. So this is the information, the whole information that I've gathered and that I've discussed in these 3-4 minutes. This is the information that you have to write in your letter. Now, if you're writing more than this, you are definitely going to exceed the word count, and you're going to write irrelevant information, because rest of the things that I've not mentioned. Okay, I hope Dr. Wafa, you're getting my point, because you have read the case notes, you have written a letter, and whatever I'm going through, I hope you are understanding that. I have not opened the case notes. The case notes are in my brain. I have revised everything for you, that the important information that should have been mentioned over here. Okay. The second thing, yeah. The second thing is this was the most important. So if you are not writing something from the information I've mentioned, you are skipping information. If you're writing extra, then you're adding irrelevant information. So this is the point that I'm just giving you. Okay. The other thing is how to organize this particular letter. So, okay, we discussed the organization yesterday as well, the purpose, the previous visits and the today's visit, and the history and the conclusion. Because this is not an urgent referral letter. I told you about urgent referral and other letters as well. Okay. This is what we have to keep in our mind when we are going to write a letter. So see, we started the class in few minutes, 3, 4, 5 minutes maybe, okay, in which I have given you all the information. So we will have 45 minutes to write this letter. But if you're smart enough, you can select the information like this, the way I have repeated things for you within 3 to 4 minutes, and you can repeat the same things in your mind. Okay, and those who have got or who are getting 390, 400 in their writing, they are doing this. Okay, and if you go on our pages, go and check. Okay, a lot of students are there who have got more than 380, 390, 400 in the writing. Okay, people are having issues with the reading these days. 460 in the reading. Okay, this is not something that we just say. We actually do. Okay, so if you follow, inshallah, you're going to be one of those, all of you who are right here. Okay. Yeah, so I have given you all the information that should have been included in the letter. Now let's just just see whether your letter is containing that information or not, or whether you have written something extra, okay, or something irrelevant or not. Okay, so because this is important, whether your organization is correct, okay, whether your purpose is good, Okay, we have divided everything. Okay, last class we discussed each and every bit of the letter. Okay, nothing was skipped, nothing was remaining. Okay, but let's just see how you have applied that knowledge over here. Okay, so the background thing, okay, that this is fine. The Dr. Smith, okay, Mrs. Priya Sharma, okay, that no problem. We can definitely write like this. Okay, I'm writing to refer Mrs. Priya Sharma. See, I told you, second name, Mrs. Sharma. Okay, Mrs. Sharma should have been written. A 6-year-old female. Okay, I know that she's Mrs. So she's female, so you don't need to tell me. See, purpose should only contain two things that I mentioned. Nothing else, nothing fancy. Okay, don't try to be, someone who likes to make things complicated, or who thinks that if I'll write complex scenarios, or if I'll write complex words, I'll get more score. No, you will get less score. If you're gonna do things in a simple way, chances of getting pass are really high. But if you're gonna be complicated, definitely you're gonna make some mistake, because no one over here is perfect. And we are definitely not native speakers. Okay, so we just have to get 350. Okay. At the end of the day, doesn't matter whether you get 400. Definitely on your own and on personal satisfaction does matter. But for your result point of view, for someone who has got 390 and for someone who has got 350, both are at the same grade. Both have B grade, nothing else. Okay, so but the personal satisfaction that matter, right? So first of all, what we have to get? We have to get 350 plus, and that is achievable if you write simple. Okay, once you are on a level where you are you are able to write simple things in a beautiful way, then definitely if you think that you have to add something, you can make things a little complicated depending upon the letter and the scenario. Okay, but not at the start. I won't recommend. Try to get done. So A should have been skipped over here. That's the same talking about. Okay, okay, you're telling me over here that she's 68, and here you're telling me she's 60. So it is a big blunder that you're making. So at start, you have written the wrong information, even though the right information was written in the case. So whether this is wrong or whether this is wrong. Okay, so the impression will be what? That this person doesn't even know what is the age, even though the case notes, the 2 pages are in front of the person who's writing a letter, but still she doesn't know the age. Why would I give scores to her? Why would I give 350 to this person? No, I won't. Okay, so don't do that. If you would have not written this age over here, okay, you might have, there might have been a loophole, right? So, but you have, you have actually created a dig. Okay, you have digged a lot. There is a pit, and now you have just put yourself in that. Okay, so don't do that. Okay, who has features of high blood sugars? How hope you're getting my point. This should have been avoided. Okay, then high blood sugar level for further management and definitive diagnosis. See, why you need definitive diagnosis when it is mentioned in the case note that she's been diagnosed with diabetes mellitus since 1999, and you are writing this letter in 2019. So it's been 20 years. She's a known diabetic, and you want a definitive diagnosis after 20 years. That possible? No. Wrong information. Irrelevant information. Wrong case notes interpretation. Okay, reason of the failure. Purpose is not up to the mark. You need 3 out of 7 from the purpose to get done with your letter. So now, because your purpose is not getting 3 out of 7, I do not need to even look at the next letter for the body. You're already failed. This thing, see, I'm saying it because I want you to improve. Okay, not degrading. Okay, but this is the reality and facts. Okay, this is the fact, the ultimate fact. It will not improve, things are not going to work. Okay, and I'm not going to sugarcoat anything. This happened. It is a costly exam. You're going to spend 1,20,000-25,000 rupees. You're putting a lot of effort. You are paid for the course. Okay, you're going to travel. It will cost about 1,50,000 all in all, with 1.5 months of the preparation, putting an effort. Okay, leaving some important things behind. Okay, and if you'll at the end, if you'll get nothing, definitely you'll be exhausted. I don't want that way. Okay, and I will, inshallah, by the grace of Allah, that is not going to happen. I will not letting you do that to yourself. Okay, so improve. I hope you have got my point. Again, next one. On this date, to Mrs. Sharma had concerned that her had concerned. Only there was only one concern, that her sugar level were okay. Then if it is sugar level, then it should be was uncontrolled. Okay, not was. She attended health center, felt that she was no. See, this is something what you just copying the case note exactly same thing and writing word, which is fine, but at least write linking word. Health center felt that. What is it? Attended the health center and felt that her concerns were not taken seriously. Okay, that she was not. No, who she. You are writing. She attended health center, felt that she was not taking her concern seriously. Is it she the one who was there, who was attending the Mrs. Sharma, or is it actually Mrs. Sharma? Not clear. Okay, a lack of case notes interpretation again. Okay, bad selection of the words. Okay, so improve. Okay, so I'll be going like this with every sentence. Okay, with every word I'll be explaining. Okay, so how we could have written this letter? Listen to me. Okay, then she checked her eyes. Who checked her eyes? Mrs. Sharma checked her own eyes, which were okay. Why? No. Okay, okay is not a word. Okay is a word when we talk about this. Okay is not a word. Okay is nothing. It's a chat. You are not having a chat on a WhatsApp with the patient. You are writing a formal letter. What is this WT? I don't know. Is it world training? Is it weight? Is it, something else? Okay. Not short form. There should be no short form. You're writing a formal letter after spending 1,25,000. Have to be very clear. Okay. Listen to me. How we can write this letter. Mrs. Sharma. On this date, Mrs. Sharma presented with uncontrolled sugar levels. Okay. She attended the health center and felt that her concerns were not taken seriously. Okay. Then, if you see, she checked her eyes. You're talking about the person who was there in the health center, right? That were fine. There were no problem with the eyes. Weight was fine. Physical examination was normal. Peripheral, there was nothing. Okay, so rather than writing 10, 20, 50, 1,000 words and explaining that everything was right, there was nothing wrong. Why we will not just write one line, that her examination was unremarkable, except blood pressure of 155 by 100. That is the important information. Okay, hope you get it. This is how we have to send it. Okay. On this date, pathology report received her FDE, this, that, in, okay, what in normal range. Again, everything is normal range, so why would you write that? Okay, and you're just telling me that these were the results and these were the reports. Okay, so just write, on this date, her pathology results, like Mrs. Sharma's pathology reports had received, okay, or which revealed, or simply, on this date, Mrs. Sharma's pathology results revealed, simple, GFR more than 60, HbA1c of 10%, along with a raised level of cholesterol and triglycerides. That's nothing else should have been. Okay, then on this date, after the results of pathology reports, she recommended. Who recommended? You recommended, right? Mrs. Sharma cannot recommend the medication, okay, herself, right? So you have to write, therefore, her metformin regime was changed from 500 mg to 750 mg. Okay. In addition, atorvastatin 20 mg and glipizide 5 mg were added. Okay. Then this visit that you talk. Please mute yourself, guys. Please mute yourself. So, uh, okay. So I hope you are there. Okay. I hope Dr. Wafa, you are here with me, right? I hope you're getting my message. If there is any problem, you can definitely ask me right away, and I'll be glad to answer. Okay. Then if you come over here on this date 3/0/01/19, fasting and full blood lipid, this and that, there was no need to write. So from this on 30th of January 2029, 2019 till this LDLC 1.1, everything could have been skipped, because if you see those visits, there was nothing important. Pathology reports, same report, same report, same report. You have already mentioned what was important, you have already mentioned. You can skip it, there's no problem. Then today's visit is really important, so let's just see. Today, Mrs. Sharma has high fasting sugar level. Her current medication is no. See, current medication was written in the medication history. If you go up, see the case notes, if I'm not wrong, in today's particular visit, they have not told you that her medications are these. No, do not make this blunder. Whatever the information is given inside the visit, write that. Do not think that because her medications are these, I have to mention, no, don't do that. Okay. So this is actually a history. She was already taking metformin 500 mg that you have already mentioned over here. Okay, in the metformin regime where you have changed it, if I'm not wrong, right? Okay, and definitely I'm not wrong, because it is mentioned that 500 to 750. So according to the scenario, if you want to write it, the current medication is what? 750 mg, not 500. That was the past. Okay, and glipizide 5 mg, you have already mentioned in the case note. If you see 500 mg to 750 mg, atorvastatin 20 mg, why would you mention current here now again? You're already mentioning. We have already mentioned that. Don't do this. Repeating of the same information, writing the wrong information at the wrong place. Okay. Selection of wrong information, adding irrelevant information, interpretation of the case notes is wrong. Okay. Then this is not good, and you have skipped important information in the high fasting sugar level. Was this what? High fasting sugar level. Okay, inside bracket, if you can just write 16 plus, and her other sugars are between 7 to 8, and this was mentioned in the case. And today's visit is important. You have to mention the right things. Okay. Ms. Sharma has 3 children. She has a positive family history of diabetes. Okay, not H. H should not be capital over here with the history. Family history. Family F small, history H small. Of type 2 diabetes. She is allergic to penicillin. Okay, so this was important. Okay, so writing information about children, I have no problem with it. If you want to write it, it's better if you would avoid. Okay, Mrs. Sharma is referred to you for further. Okay, so you have told me that you are referring the patient over there in the case, like the purpose. You told me that you are referring. I am writing to refer. So why would you tell me at the end again? Okay, I'm referring. Now patient is there. Okay, so you don't need to say the same thing. You don't have to write. In view of the above, I would be grateful. Yesterday I mentioned it. Okay. In view of the above, I would be grateful if you could further assess and manage Mrs. Sharma's condition accordingly. Okay, simple line. If you want to create your own, I have no problem, but write somehow a similar uh, to this thing. Okay, rather than creating something which is something which you have written already, or you are telling me the same information over and over. I hope I am making sense. If there is any problem, Dr. Wafa, with this letter, do let me know. Okay, I'll be addressing. Okay, I'll be replying everything. Yeah. I hope you're getting my point, right? Is it clear? If not, then do ask me. Okay. So I would say